All right. Hello, I am Andrea Perdomo Morales, and I serve as the co-chair of the Social Work Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Carolyn Saspron.
Present.
Donna Honer-Quayle.
Present.
Sarah Behrens.
Present.
Mary Gill.
Present.
Mike Gillette.
Present.
And Mike, did I say that correctly? I apologize.
Yes, you did. Mike Gillette.
Okay.
That's correct.
Thank you so much. Leanne Gendry.
Present.
Thank you. Angie Heller Workman. All right, maybe she'll be joining us soon. Jane Holtz Richter.
Present.
Catherine Reck.
Present.
Did I say that correctly?
You did.
Thank you. Eric Schonecker. Maybe I need help pronouncing that. I apologize.
Present, and it's Schonecker.
Schonecker. Okay. Let me. Okay, I apologize for that, Eric. And Kristen Stice. And Robin Unruh.
Present.
Did I pronounce that correctly this time, Robin?
You did.
Oh, good, good. All right. I will try my hardest to remember that. I thank you guys for your patience. All right. I note the following BSRB staff members are also present: David Fye.
Present.
And Leslie Allen.
Present.
Thank you. Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Andrea. And Kristen Stice did go ahead and enter the waiting room, so I went ahead and let her in. And we have another member of the BSRB staff, Sammy Barksdale, who's going to be sitting on this meeting, so she is also present. There's one more individual in the waiting room, so we're going to go ahead and let them in. That should be Angie Heller Workman. So we'll go ahead and let her in.
Thank you.
Just want to verify that that is Angie. So, and Angie, is that you that just logged in on the Zoom call? Yeah, it appears to be so. So Angie Heller Workman is also present. Now I'll go ahead and read a short message about this meeting being held remotely. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at the meeting today, as no individuals requested to provide public comment. Because we are conducting this meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to the meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended, so we will be conducting this meeting pursuant to the KOMA. On April 16th, 2022, we sent notice of the advisory committee meeting to all individuals who requested notice of the advisory committee meetings. And the notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at the website, and an agenda and other meeting materials for this meeting have been posted to the website. You may also request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows members of the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda.
Thank you. The meeting is now called to order and the advisory committee will begin its discussion of the first agenda item. All right, so with that, thank you everybody for joining us this afternoon. Hopefully everybody received all of the materials in advance and had an opportunity to review those. We're looking forward to a very lively and fruitful discussion today. And just once again, wanted to take an opportunity to thank you all for making this commitment to be a part of the advisory committee. And we know that you guys, your time is very valuable, but your input is so crucial to the work that's being done. So appreciate that. We have next on the agenda is approval of the agenda. Does anyone want to motion for approval?
Will there be discussion after this?
As far as new items?
In terms of old business? Old business
Yes, we
item?
will. And Mike, are you referring to the old business items that are already on there or something in addition?
No, correct. Old business item that's already on there.
Perfect. Yes, absolutely. We will cover that in the agenda. But if
I motion to
somebody
accept the agenda.
Perfect. Thank you, Eric. We have a motion to accept the agenda as is.
Discussion?
Okay. Do we do that now?
Well, just to clarify, Mike, are you wishing to add any items to the agenda, or were you going to discuss items when we get to the old business part of the agenda?
Yeah, it's confusing because it's listed under old business, the item of that I have a question about that was voted on in the October meeting. So it seems like it's an item that should not be on the agenda.
Okay. How about if we talk about that when we get to the items in the old business, and then we can kind of discuss if there's any new items or anything like that. So
Yeah, that's acceptable.
Okay.
Thank you. Move that we vote on the agenda.
Thank you, Mike. Thank you for speaking up about what you would like to discuss. All right, so anyone opposed to accepting the agenda as is?
No, I second the motion to approve the agenda.
Thank you, Carolyn. All right, all those in favor?
okay, and Lee is on the phone. She also wanted to second that, and I think
Okay.
Carolyn's second was first, and so
Thank you for reminding me about the phone, David.
Sure.
All right, all those in favor say aye.
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 Thank you. All right, motion carries. Agenda is approved for today. We have the next on the agenda is review and approval of minutes for previous meeting that was held on February 15th, 2022. And I would love to take a motion for approval of the minutes from February when anyone is ready.
I would move to approve the minutes of the February 15th meeting.
I'll thank you. Thank you, Jane, for a second. Any opposed? All those in favor say aye.
Aye.
Motion carried. Thank you. The minutes have been approved for February 15th. Next on our agenda is the Executive Director's report.
thank you, Andrea. I'll go ahead and provide some updates to the advisory committee on some items relevant to the work of the BSRB, some legislative updates, and then also some updates from some recent board meetings. So concerning recent operations by the BSRB, we are still under some of the governor's directions from earlier stages of the pandemic. We have had some relaxation of certain directions from the governor's office. There had previously been a direction that all state employees in state office buildings had to wear masks, and that is now an optional requirement, or it's now an optional choice for employees. However, we are still under a number of the governor's other directions, one of which was to avoid in-person meetings. So currently we are still unable to have in-person meetings for the board or advisory committee members, but we will let you know when we get further direction on that from the governor's office. In terms of our staff, most staff are working in the office each day. We do have a telework pilot program that we submitted for approval last year, and we were approved to do that. We have both investigators in the office. They are teleworking a limited number of days, and we're collecting information on how successful that's going, looking to possibly expand that when we move to the fall. So we're looking at that for the first half of the year, and then we're going to consider expanding that. So, but otherwise, we are moving forward with trying to license individuals and answer questions here at the office. In terms of some legislative updates, the legislature is currently on a 3-week break. There are a number of legislative deadlines during their process of a legislative session. They have their first period of time where they try to get all bills through their chamber of origin. And as that has to do with, House bills making it through the House committees and then across the House floor, Senate the same way. And then they have another deadline where they try to get it through the second chamber. And then they move to a period of time to where when bills have been passed by both chambers, if there's items of difference, they go to a process called conference committee, where leadership of both the House committee and Senate committee comes together and works to resolve any of those items of difference. They passed a number of bills before they broke for a period of time. They're going to come back for the conclusion of the legislative session. It's generally referred to as omnibus. And so this 3-week break allows the governor time to review all the bills that they have passed, and to the governor can either sign items to go or bills to go into to become law, or if the governor does not sign the bill, then it can become law after a period of time. If the governor vetoes a bill, then it's considered vetoed. When the legislature comes back, they can consider any vetoes from the governor's office or could pass new legislation. Generally, when they come back for this omnibus period, they have updated revenue totals, updated totals on expenditures that are required for human services. It's usually called the human services caseload. And then occasionally there is a tax bill or an appropriations bill that is passed to resolve any remaining items. And then sometimes there can be additional legislation, but it tends to be a pretty brief period of time. So as I mentioned, the legislature right now is on that 3-week break. Some of the bills that were passed by the legislature before they broke is the appropriations bill for this session. That is House substitute for Senate Bill 267. That includes the budget for the Bsrb, adjustments for this current year, and also our budget for next year as well. The House and Senate both agreed to the items that we had requested in our revised budget estimate. And that appropriations bill is pending with the governor. The governor does have the authority to do line item vetoes from the appropriations bill. So we are just waiting to hear on if the governor will sign the appropriations bill, and if the governor signs the bill, will there be any vetoes, and then the legislature can consider those when she comes back. I don't expect there to be a significant adjustment for the Bsrb, but I will keep you informed if there are any items that would affect all state agencies. Second, I have some really exciting news. The bill for the Bsrb has passed the legislature. That was originally Senate Bill 387. And that bill included 3 recommendations from the board. There was an item for the social work profession. There was also an item for the addiction counselor profession, and then one for licensed psychology. Senate Bill 387 was heard in the Senate Public Health and Welfare Committee, and that committee amended the bill to remove the recommendation by the board that had to do with the licensed psychology profession and the recommendation to require continuing education hours in the topic of diversity, equity, and inclusion. So that Senate Health and Welfare Committee amended that part out of the bill. And then once they amended the bill, they passed the amended bill out of the committee. But they did not pass that on the Senate floor prior to one of those legislative deadlines. So Senate Bill 387 died. Normally that would mean we would not be able to have legislation this year. But I had a number of conversations and spoke to members of the legislature on the House side and was able to get that amended version of the bill, Senate Bill amended 387, introduced as a brand new bill on the House side. It was introduced as House Bill 2734. And that bill was introduced in House Appropriations, referred to House Health and Human Services. It was expedited for a hearing, and it was heard in that House committee. The committee went ahead and decided to work it the same day, and ultimately it was passed on the House floor. So that meant that it had passed one chamber, and thus it became eligible to be discussed in conference committee. So when the House and Senate had health committees that conferenced on bills that had been passed by both chambers where there were differences, they talked about another bill, Senate Bill 453, and they agreed to add the contents of House Bill 2734 to Senate Bill 453. And then that bill was run as a conference committee report, a CCR, on both the House floor and the Senate floor, and it passed by wide margins in both floors. So that bill was passed by the legislature. So the items for the BSRB and the amended bill, that is the social work recommendation and the addiction counselor recommendation, those have passed the legislature and were sent to the governor in Senate Bill 453. And yesterday evening, I did notice that the governor went ahead and signed Senate Bill 453 into law. So I have not seen the final report, but I believe that means that the bill is now considered law. The effective date of the legislation was publication in the Kansas Register. So that is a weekly publication by the Secretary of State's office. So once the Secretary of State's office publishes the content of Senate Bill 453, then we can move forward with adjustments that are needed to adopt the provisions that were put in for the BSRB in Senate Bill 453. So really excited about that. Been a lot of different swings back and forth, but very happy to be able to move forward on that very soon. We do plan to send out a message to all licensees concerning the bill once it becomes effective. So that should be pretty shortly. We expect it to be published by the Secretary of State's office later on this month, or at the latest sometime in the early May. So another item that was added to Senate Bill 453 before it was passed by the legislature concerned a Master's of Social Work program for Fort Hays State University. So Fort Hays State University had recently started a Master's of Social Work program. It was an all online program. And those individuals, that school is going through the process of becoming accredited. And it is seeking to become accredited. So it is now in the process called candidacy. And they expect to receive full accreditation by February of 2023. And so there had been some confusion based on past conversations between representatives of Fort Hays State and the BSRB concerning how individuals who came from that program, whether they would be able to be licensed while the program was in candidacy. So our requirements ask us when someone applies for licensure, we look to the statute and regulations. And the statutes and regulations say if you come from an accredited school, there is one path to licensure. And if you are not from an accredited school, there is a different path to licensure. And that if you are not from an accredited school, there's a certain amount of courses that have to be obtained in residence, which means physically at the institution. And so there was an issue with these students coming from the program while it was in candidacy and whether they would be able to become licensed. So what the legislature did in Senate Bill 453 was they added language directing the BSRB to recognize graduates of that program retroactively. And also through the end of fiscal year 2023, basically as if it was an accredited program for the purposes of those students being able to sit for the licensing examination. So those students that are coming through that program will be able to take the test for licensure, assuming they meet the other requirements, such as paying the appropriate fee and meriting the public trust, and that there's no other issues like that. So that also was included in Senate Bill 453. And that process was discussed by the board at a recent board meeting, which I'll discuss here coming up shortly. Another legislative update that I wanted to provide for the advisory committee had to do with substitute for Senate Bill 34. So that bill essentially had different versions as it made its way through the legislative process this year. It had to do with the Joint Committee on Rules and Regulations for all state agencies. And originally it would have required state agencies to make some pretty dramatic changes to their rules and regulations. The final version of that bill essentially required all agencies to submit a report to that Joint Committee on Rules and Regulations every 5 years on all of their regulations to indicate whether the regulations are necessary to implement state law, or if they are not, then they should pursue a process to revoke those regulations. It was ultimately passed as House Bill 2087, and the BSRB was included in that bill, and we must submit a report. All agencies are initially on a 5-year schedule. Our year that we come up to provide that report to the committee is 2026. So from the time it is published in the register until then, we will be creating that report and then submitting it to the legislature to show whether our regulations are necessary to implement state law. So that's one thing we'll be working on from now until then. Some updates from the recent board meetings I wanted to make you aware of. First, let's start with the board meeting on March 14th, 2022. So the board has been meeting from about 10 in the morning until 1. The board decided that as long as the meetings stay online, they will move their start time to 9 a.m. and go from about 9 a.m. until noon. So if you're someone who watches those board meetings, just be aware they're going to have an earlier start time, at least as long as they have remote meetings. The next item is last fall, the board spent a significant amount of time revising one of their internal documents, a board governance policy. This document directed a lot of the instructions for board membership and some of the policies that board members follow. That document had not been updated in about 11 years. And so the board spent some significant time looking over the items that were in that previous policy and asked me to draft a report with items that could be changed or items for discussion. And then the board took that report that I put together and had a discussion at another board meeting and implemented a number of changes to that. The ultimate result was that they created 2 new documents. One was an expectations of board members document, and the second was an advisory committee policy. And while some of the language was similar to what was in those documents before, there were a number of changes. So with that framework, there is also an investigation policy that guides the work of the complaint review committee of the board that investigates complaints against practitioners. That investigative policy has not been updated since about 2009, so it is also due to be updated and some of the terminology brought to more current terms. And so I'm in the process of working on a report for that, and I'll be presenting that to the board at the May board meeting so that they can review possible changes and then provide direction on revising that document going forward. The next item in the process the board is working on is that in statutes and regulations, there are a number of references to the board, and some of those references really mean the full board, and some of those references mean the BSRB acting on behalf of the board. Sometimes it means the executive director as delegated by the board. Sometimes it means another group, such as the complaint review committee, possibly an advisory committee, or possibly a board member. So to clean up that process, we are coming up with a master list of references so that it is very clear when it mentions the board, which group it is actually referring to. We have a number of delegation motions that have been made over the year, but we are going to refresh those delegation motions to clarify the authority of those references, and so we can use that going forward. Also, the board discussed the topic of board-approved supervisors and whether there are sufficient opportunities for board-approved supervisors to receive the training. That was a conversation that primarily related to professional counselors and marriage and family therapists, as those are the 2 groups that currently have board-approved supervisors. But the board members noted that if there are insufficient trainings, is there anything the board can do to help that process? So that was a conversation that was started, and I think the board will continue to have that conversation going forward. The next item I wanted to make you aware of, so I was recently invited to sit on a committee for an association. That would be the Cypac Commission, which Kansas became a part of back in January of 2022. It's a multi-state compact for licensed psychologists, primarily to provide telehealth services in other compact states. So when I was offered this position to sit on one of those committees, I brought it to the board to see if the board would like me to bring future opportunities to them for approval, or how they would like me to handle those types of offers. The board basically directed me to use my best judgment, knowing that my #1 priority should be making sure that there's enough time to do the responsibilities and my position as executive director, but also knowing that potentially sitting on some of those associations could have a beneficial effect for the state as well. So I did decline that option with the Cypac Commission, but if I do accept any positions on other association committees, I will let you know that going forward. In terms of some topics for future board meetings, the board discussed that they are wishing to look into the possibility of having an impaired provider program. So in other states and for some other agencies, as a tool to assist in the process involved with complaints against practitioners, or if practitioners have had a substance abuse problem, or if practitioners are needing mental health services. Some agencies have partnered with a provider to assist with referring or having practitioners voluntarily submit themselves to an impaired provider program to get assistance, either in lieu of disciplinary action or as part of that process. So there's a few different options for that, but that is something the board is looking into in the future. Some of our legal counsel from the Attorney General's office is familiar with some of the programs that are out there, and they're going to be providing more information to the board at upcoming meetings. Another topic that the board may discuss at future meetings is the approach to telehealth standards in general for the professions. There are a number of other states that have put in specific instructions for practitioners when it comes to telehealth standards. Additionally, the legislature has been considering bills which would put in place telehealth standards. So if the board wished to go ahead and put forth telehealth standards for the practitioners, it would be a good time to go ahead and do so. So the board may have discussions coming up on that topic. One other item I wanted to make you aware of. So the board did have a special board meeting on April 15th, 2022, just less than a week ago. And that had to do with discussions that I mentioned earlier involving that Fort Hays State Masters of Online Social Work program. And so when that item came up before the board, or when it came up, there was not a lot of guidance for the Bsrb in terms of how to handle students from programs that were in candidacy for accreditation, but were not accredited. And some of the requirements for licensure that focus on the in-residence requirements of certain professions is something that the board had a good discussion about, because we will have other programs and different professions too that will be starting. And if we are not able to license students who come from those programs while they're in the accreditation process, it's going to create some issues. So at that April 15th board meeting, the board discussed that it would be looking at the in-candidacy requirements for the different professions going forward and collecting information. It will also be collecting information for the standards by which programs are accepted into candidacy. And it will be looking at developing a new type of provisional license. This provisional license would be to allow students who come from programs while they're in candidacy to be able to get that provisional license while their program is seeking accreditation, with the ultimate goal that if the program becomes accredited, they'll be able to evaluate those students under the accreditation standard. And if the program does not become accredited, we will use the existing standard, but it would be something to assist the work of the board and also the Bsrb while those programs are going through the candidacy process. So that's something that the board will be working on this year. And I will be going to a couple of conferences coming up, one of which is actually for the Association of Social Work Boards, ASWB, and that will be not this week, but next week. I will be attending a conference in Chicago, and one of those days is based on different executive directors and administrators for different boards, and they're going to open it up for questions, and I'll be seeking information on in-residence requirements in other jurisdictions, and also seeing if there are other states that have anything in place for schools like this while the program is going through the accreditation process, and how those students that are coming through those programs are able to be handled by the licensing bodies. So that is a thing that I will be attending next week. And then just to let you know, at the end of this week, I will be out of town for a mid-year meeting for ASPPB, which is the association which works with our licensed psychology professions. And so I'll be attending that meeting and collecting information for that profession as well. So with that, this is a lot of information that I provided, but I'll go ahead and end my report, and I can stand for any questions if you have any questions.
David, this is Jane. When you had made the comment about, you were talking about the difference of the board, the BSRB, and you had even used one other term of clarification. Tell me a little bit more about that. You said that they were trying to clarify the different wording on that. Was that at the board level that they were trying to clarify that?
Well, that's actually something we were wanting to clarify with the help of the board for the BSRB, just to provide clarity on some of those processes. For example, most of the references to any authority for the agency makes reference to the board in statute and regulation. But for one of those, for just as an example, it mentions that the board will have authority to hire clerical staff for the agency. Well, that's not something that the board actually does. They don't do the interview process for that. They delegate that to me. But we have language in statute that says the board has that authority. So what we'll be doing is just going through statutes like that, and wherever it says the board, we'll be making sort of a master list for reference, just to let individuals know if it says the board here, it will be referencing either the full board, or it'll be referencing the BSRB acting on behalf of the board, or it'll be something delegated to the executive director, or possibly to the complaint review committee, a subset of the board. But we're going to be going through and renewing the motions which delegate that authority outside of the full board, just so that we are doing our due diligence to go back and have something to show where that authority was delegated to other groups that are not the full board.
Basically, you're assigning job duties and tasks to each category then. So each delegation. Okay, I got it. So thank you.
You're welcome. And those were mostly done over the years. But as things have moved forward, it would be good for us to have sort of a master reference list.
Right.
So that we can point to those items. And then if someone questions, well, is this something that needs to go before the full board? We can say, no, that was actually delegated to the BSRB by the board. And we can say the delegation happened at this meeting, or the renewal of the delegation happened at that meeting. So it's one of those things that will probably take some time, probably something that'll be over the next year. But I think it's important for us to have a clear record of that.
Thank you.
All right, any other questions for David? Thank you, David. Before we move on to our next agenda item of old business, just wanted to take a moment to thank David again. He has been doing a tremendous job since he's taken on this position of making sure that the board is very up to date and aware of all of the different items that are going on in legislation. As you all can see, there's a lot of moving parts. Almost on a daily, sometimes I'm sure hourly basis, and he has to keep on top of it and make sure to keep the board's interest in mind as he's advocating out there. So David, thank you so much for your work on that.
Thank you, I appreciate that.
All right, then moving on to old business. And Mike, I do want to open it up for you first to bring up your discussion items.
When I look at the old business items, it looks like there are at least 3 different areas. And I was curious why we didn't list them as ABC, like A, clinical supervision, B, workforce issues, C, possible continuing education requirements, or area of diversity, equity, and inclusion. And so then my question would also then be, it's really not one item. Those are 3 different issues. But not knowing what the consolidated bill 453 says, I don't know if they had excluded or removed any portions of what had been proposed originally, as the one bill had excluded the areas of diversity, equity and inclusion. But with the new bill and the House, and then the consolidated bill, I don't have any idea if that's in there or not. So I didn't know if these are items then that would have then come to us through the board, through the BSRB board, or if these are old business items that were from our records of past meetings. That's really what my question is.
Okay, and I can clarify the legislative item first. So the final version of the bill that made it through the legislature, it did not include the board's recommendation that would have required continuing education and diversity, equity, and inclusion. That was in the bill that was originally requested by the board, Senate Bill 387. But that item was amended out of the bill by the Senate committee. And so basically when that item was removed by that Senate committee, that was taken out of the legislative items for this year. So even though we were able to get a bill introduced on the House side after that, what we did is we took the amended version of the bill that only included the social work recommendation and the addiction counselor recommendation, and we were able to get those two items introduced as a new bill, and then they moved forward. So there was no legislative item this year that would have required continuing education and diversity, equity, and inclusion.
And David, sorry, Mike. David, I just want to clarify that when that went as a part of Senate Bill 387, hopefully I'm saying that correctly, originally, that did not include a recommendation for social work to include DEI training. Is that correct? That was only for psychologists?
Yes, that's correct. There was a social work recommendation, but that social work recommendation had to do with, there was an item in the bill last year that had to do with allowing us to consider non-clinical practicums. If individuals applied for a clinical licensure and they had like a different type of practicum, like an administrative practicum, we had language that was already in statute that would have allowed us to consider individuals who applied for license. But when they made an amendment to the bill last year, they struck out some of that language that basically allowed the board to consider their postgraduate experience as approved by the board. So the item that was originally in the bill for social work, that had to do with looking at practicums and requirements for licensure, but there was not a recommendation in the bill that had to do with continuing education and diversity, equity, and inclusion for social workers.
So, Mike, although it was taken out in Senate Bill 453, we decided during this last committee meeting of the social workers that the three items that we would be working on this year would be regarding discussion of clinical supervision, workforce issues, and then the possibility of bringing back up the continuing education requirements at the area of diversity, equity, and inclusion, in hopes that we would bring all of those three items with a plan and recommend in a full recommendation that this committee is supporting to then be used in the future.
And I think with new members, Mike, too, we felt that it would be good to, sort of just review those. I know that we have talked about the clinical supervision and the CEU requirements, but we thought this would be a good opportunity to review and see where we want to go forward in terms of 2023 legislation and what we need to do to get there.
Thank you, Carolyn, because I know that last year we had it proposed to the legislators that they include clinical supervision requirement for social work, and that was struck down or was denied. And that's why I was a little bit curious if in the consolidated bill 453, since things were coming back from previous years, if that was an issue that had been considered, but it was not. And so, yes, I agree that that's something that we still are concerned about. I am,
Yes, we can still
I think-
include, we can still revisit it next year. We can,
Right, right. But then on the issue, the third item though of the diversity, equity and inclusion, we had voted, and I only have a copy of draft minutes. I don't have concluded or finalized. And these are from the documents that had been sent out for this meeting. But for the October 19th meeting, it says draft minutes and it has draft across the document. So I don't know if we had actually ever approved those minutes or not. But in those minutes on the second page under continuing education, diversity, it says that it clearly states that we had voted to not have that as a requirement. So I don't know if that just means we're going to keep discussing it again, but it appears that we had actually already discussed that item and
Yes.
I decided to take it out.
I'm glad you brought that up, Mike. And that is accurate that when we brought that to a vote to the committee, at that time, there was, it was only one person voting for, and then the rest were voting against including it. And then from that meeting, or I should say after that meeting, the Bsrb staff were kind enough to put together a survey monkey and sent out those questions regarding clinical supervision and around what licensees' thoughts were around including DEI, diversity, equity, and inclusion in the continuing education. And from the results that we received, there seemed to be support of those two items. Based on feedback of the survey. And so then in our last meeting, we then brought it back up and decided to pursue it based on the survey monkey results. But please, Carolyn, David, or anyone else, correct me if that sounds incorrect.
Okay, thank you. And I accept that as an answer for that question. It's that also then brings up a second question about old business. The survey monkey results that we had referred to in previous minutes. I'm sorry, I don't have, it wasn't in the February. I think it was in the November, no, it wasn't November. It must have been in the October meeting where we, it made reference to the survey monkey results. And I just received a copy of them yesterday, and maybe I should have had a copy of those before, because I have not been able to do any kind of analysis on them myself, other than just a quick reading through of the 25 pages of results that were sent out. So it seems like that should be an item under old business. And I didn't know if I should have proposed that when we were approving this agenda, or if that becomes a new business item for a future meeting, if we should decide to look at that information to help inform.
Yeah, and I can kind of answer some of that. So the survey was sent out in December, and then we collected that information and put together the information into a report, which was posted on the Bsrb website. The results of that report we did go over at the last meeting in February. So I went ahead and I pulled up the report and kind of walked through the results from that survey. And so that kind of was what we did at the February meeting. And you had asked a question about if the minutes from the October meeting had been approved, and those were approved at the February meeting.
and I think because of the survey results, we pursuing means on the CEU requirement means to relook and revisit that from our last decision, because of the survey showed some favorable support. So revisiting means for all of us to take a look at that again and to vote again, whether we support or don't support with this new information.
Yeah, and you mentioned you just got a copy of the report. So I appreciate you bringing that up. That is something I forgot to mention during the executive director report. So at the February advisory committee meeting, we went ahead and kind of walked through the results from that report. But we did appreciate the over 1,000 social workers who responded to the report and submitted information that was really helpful for us. So we had a conversation, Andrea and Carolyn and I, and Andrea thought it would be a very good idea to go ahead and thank those individuals. And I totally agree. And so that's a lot of social workers got a message yesterday, just thanking them for their responses to it, and also pointing them to the website where they could go and see the full report so that they could kind of see some of the work that the advisory committee and the board is doing. And so they could be informed about what other people responded in terms of the information they provided to us from those survey questions.
I'm glad you mentioned that, David, because I was going to thank you and actually it's Andrea's report that whenever we have a survey, I think it's really important that we make those the results available to everybody. And so David was kind enough to draft a really very thoughtful letter thanking people for participating. And I thought that was really, really good work for the committee to do that. And thank you, Andrea, for the idea, and David for doing that.
Right. And I do remember David giving a summary of that report of the results, but having not had the results in my hand or not seeing it, I didn't know what the conclusions really were or the statements that were made. There were many statements made concerning the clinical supervision, but that's something that is on the agenda. So that you've answered my questions. Thank you.
No, thank you, Mike. Thank you for bringing those questions up. Yes, so thank you, David, for putting together that email. Just as we were talking, it's important that as we ask for feedback from all of the individuals that get the emails from Bsrb, that we let them know that we are listening as a committee and taking their input and using that to make informed decisions. So with that, Carolyn had suggested bringing back up our focus areas of clinical supervision, workforce issues, possible continuing education requirements on diversity, equity, and inclusion. And just we really do need to decide how we're going to move forward in delving deeper into each one of those areas to really gain an understanding of what recommendations, if any, we're wanting to make within each of those areas. So I actually, Mike, would agree that we probably do need to sparse those out to say A, B, C, versus putting them all together. But I think that was just a way of capturing the information in one line item. So any thoughts on how, as a committee, we would like to move forward with breaking these down? Is that breaking up into different committees? Is that a full committee discussion? What are individuals' thoughts on that? And I apologize, I have to step away for 2 minutes, but Carolyn and David, I will be right back on.
Okay.
I can start this, at least in terms of the workforce topic.
Right.
Yeah, so Carolyn and Andrea and I discussed that, and we were discussing if there are items relevant to workforce. You know, the Bsrb is a public protection agency, and so that's our primary mission. But we do have a small group of licensees that have an associate level social work license. We no longer offer that as a new license for individuals, but we were able to allow those who had that license to renew it. And even though we have not offered it probably in at least the last 20 years, there is a small group of about 8 people that continue to renew that associate level license. And I have looked through, or started the process of looking through some of the minutes from those meetings, but we're going back a long, long time, because I don't honestly know the circumstances for why that level of license was discontinued. But I will continue to look at that to provide some historical information for the advisory committee. But I do know that used to be a level of licensure for the Bsrb, and it technically still is. It's just we don't license individuals in that level any longer.
Yeah, I've been here for 8 years, and when I joined, I had no idea. It was still the few eight, and I don't know when that began. And so the question is, do we want to continue that, or maybe make that more, make people more aware that that is an option at that level?
Not an option right now at that level. We only have authority to keep renewing the LASW.
Okay.
We don't have authority to issue any new licenses.
Okay.
And I think the question was, how are we going to look at these three broad areas? Like, do we set up subcommittees, or how are we going to look at these rather than doing it always as a collective group? Am I understanding the question correctly?
Well, my question is, Leslie, if we don't have the authority, is this something that we want to gain authority, on? Is it a level that's relevant? I mean, we have BSW, MSW, clinical. Obviously there's 9 people that are doing some type of work, and I don't see, is there like a description of that particular level? I have no idea. And if so, what is it? And could it be useful to our profession to increase those numbers?
My point is, I think the workforce issue is greater than just the issue that David mentioned about the associate degree. I think the workforce issue also included licensure recognition of Missouri. It was one of the things in terms of reciprocity. Is not a term that we use in our state, but that seems like the workforce issues are greater than that one license thing. And then I would go back to the clinical supervision issue of there, are we asking to be able to have recognition of social workers that are clinically are licensed to clinical supervision status? And I think each of these we could say, even with the inclusion of the DEI, there were some other issues that people had asked if we would add some continuing education in the past. And so I don't know if that's just one area. Not even know the complexity of that one area. So I think the question was, how are we going to do this work?
It seems like maybe we should start one by one, because we're going back and forth. And I think the reason why David brought the workforce information was that Andrea stepped out for a second. So we can start wherever you would like to, Andrea.
Yeah, I mean, if we want to start with the workforce one, is everyone okay with that? Because it would be interesting to see what areas we, as the BSRB board, would be able to recommend or have input on. So David, do you mind providing some updates on the thoughts that had initially come to mind?
Yeah, so I just mentioned that I had looked into that associate level social work license to see when that was discontinued, but that goes back at 20 years. So I haven't found a lot of information surrounding the circumstances, but I'll keep looking. In terms of another item for the workforce, I touched upon this when I talked about the Fort Hays State situation and future programs that are going to want to come forward. I think one thing that the board talked about discussing, I think would be relevant to the work of the advisory committee too, would be taking a look at the current in-residence requirements again for the different professions. And I mentioned during my report that I was going to be meeting with ASWB, other administrators for other boards across the United States, and trying to collect information on what those states require, or if they have a similar requirement to us. But I think that's something else that would fall under the workforce discussion, is is looking at our current requirements, specifically that in residence requirement for the profession.
You know, one of the things that made me think about it when you were talking was like the LPN versus the RN, you know, and equating it to that. And then I was listening to Leslie say that we can't necessarily license anybody else. So we would have to, you know, bring it back in. And so it would have to come back through a process. But is it something in the workforce that we could generate more market for people to come in and test the waters so that they would understand what is out there and what it takes to do some of this work before they get at the graduate level and they get into this work and then they leave in a very short time because they don't want to stay. And that's kind of where we're at right now. And so, you know, is it something that maybe has some merit to consider at an associate level? I don't know.
I think that's a good point. Those are good points, Jane, and I think it's certainly worth looking into.
Yeah.
What
you
would
know,
it
we're
look
having
like?
to open our minds to a lot different of thought process today than we did 10 years ago.
Yeah.
We were in a better position 10 years ago than we are today in the job market.
Are there colleges that are actually providing an associate's of social work?
It's a good
I
question.
think they would. I think they would
Yeah.
if it was available.
Yeah, if there's no markets where they could sell those students to, then why would they develop a program? You know, it's like, what comes first? Seems like, I would say that this also deals with the public protection that is under new business items, because it also would deal with the conduct regulations in terms of unprofessional conduct, because it would all tie. It seems like it comes together.
I don't know. I don't know if I agree with that. I think it's more about workforce and
What do others think?
Well, my opinion is, I don't know that we want to water this down. And that's kind of what I feel like we would be doing. We have all these high standards, and then to say, well, we're going to lower them. And not that we would lower them. And I'm sure there would be a place for an associate in social work, but there's a reason why it hasn't occurred over the last 20 years. And I guess I need more information.
Mhm.
I would wonder if this is comparable to the licensed addictions counselor that when I first started my career, the LAC only required an associate's degree, but I believe it now requires a bachelor's degree to have that licensure.
Mhm.
And aren't we, what we're talking about here, similar to that?
Mhm. Maybe so.
well, and think about it, case managers, attendant care workers, child care providers, you know, where would we put them in that market? We're not talking about clinicians, you know, we're not talking about licensed private practitioners. It's like, where is the market opening this door to? What can we do that we enhance those skills and we put them in places that we want people to be knowledgeable and helping our public.
So
be
I think this is
educated.
a good discussion to also figure out what information are we needing in order to make a more informed decision. So certainly today is not, we don't have to walk away here today with a decision or a precise plan, but identifying what are the items that we need more information on, more data on, lessons learned potentially from when that level of licensure was active. To someone's point, I think that they brought up earlier, was there a reason why it went away and hasn't been around? So just kind of analyzing all of those different aspects.
And of the 9 people or however many there are, I'm wondering where they're at or what type of work they're doing. And that's one of my questions. When I think about work areas really needed is, I think of child welfare, because we're losing a lot of social workers in DCF, and what used to be predominantly all BSW social workers now are including, there's almost anybody that's willing to help, but I'm sure there's a lot of areas that, that's it, but we could further our discussions somehow or organize ourselves, either having a task force or something that could look more into the questions needed. I don't know that we can resolve everything today.
And is this something, as we gather more information for the next board meeting, do we want to go through them as A, B, C? And, do we want to focus on workforce shortage first, and then after that, pick our second topic? Or how would you guys like to approach these areas so that we can make the highest impact and use our time wisely?
I mean, I would agree working on the workforce is primary because that is such an emergent need. So deep diving into that, I think, would be primary from my standpoint, because it's the most needed at this point, I feel.
Thank you, Sarah. What are others' thoughts?
I agree. The workforce is pretty important. As a BSW licensed, it's hard to get guidance to encourage other people that are on that level to go to jobs that aren't being supported, maybe by a higher social work position. So you're in an organization that doesn't have a social work person that you can go to. So there's not really much guidance if you have questions. And so I think it's important that we look at, when we do put people in those kind of workforce situations, how do we support them?
Thank you, Angie. Any other thoughts or creative ideas, or any other best practices out maybe in other states that we should take a look at when looking at the BSRB's role in addressing workforce shortage?
I have a question about workforce jobs. Are there specific regulations they have in place for like what level of licensure people need to be at, like in nursing homes or skilled nursing facilities, LTACs, that type of thing, when they have a social worker or case manager there? Do we know who determines what level of licensure they have to have and what type of supervision they are required to have in practice?
And I think I might defer this one to Leslie Allen, because she can talk a little bit more about maybe some of the history of how that's been discussed.
So we would not have a list of what they can do at each licensing level. We don't have that. It's usually up to the agency to determine what the job is and the job duties, and then they decide, what level of social worker they would need. We do have a regulation for supervision. It's not specific to job placement though. It's just supervision of temporary licensees or, things like that.
I guess I would just add, I don't know if it's relevant to this discussion or not, but
I can kind of speak a little bit to the nursing home question.
And Katie, I think we're getting some feedback on your end.
Being a director of social services,
Katie, do you mind go ahead?
I was trying to answer the question about the nursing home question. So actually, the nursing home guidelines are. I'm going to try to turn my video. Does that help anything?
A little.
I was trying to answer her question about the requirements for like a nursing home, social services, or social worker, where those come from. And it's my understanding that like KDADS has an expectation of a licensed social worker in a nursing home, as well as the Centers for Medicare Services would dictate that. So that's like a federal expectation. So you just have to have one LBSW and then supervising either social workers or what they call a social service designee, which is a person who has just a class, like a month-long class in social services.
So I was just going to add on to my thought about the workforce with that category too. I know that foster care is a huge need, but I think that those areas also have a huge need for I want to say not a lower level, but maybe an entry level beginner type of licensure, because many places that I work with have a designee and maybe they have like one social worker who's overseeing 3 or 4 different facilities. So just another area where I could see that an associate type of licensure would be useful.
Yes, because the case loads are so high, at the BSW that often they leave, and the pay's not very good, too. But I think that if you could distribute the work, a little bit, where the caseloads were so high, I think that this level might be very helpful as well. Does any other jurisdiction have this level, as from state to state, from associates level? I've not heard of any really outside of Kansas. David, do you know that, or Leslie, do you know?
It's on my list to ask in terms of other jurisdictions, but I have not heard that from other jurisdictions, but I've had limited conversations about that topic. So.
And I think that's a good point of, David, when you go to that conference, when you're looking and kind of researching and getting that feedback from other areas or other states, that might give us some of that information to be able to flush some of these other questions out and or guidance on how to really address those. Because I think there is some warranted, there's some benefits to being able to open up that for certain things like daycare providers. I mean, if I was looking for a daycare provider and saw that they also had associates in social work, may change my, I may want to pursue that as opposed to a different daycare provider. So I think it does open up the workforce in that way, but also give us guidance on if we do need to flush out specific things that you can do per license, and being very clear about how to differentiate between the associates and bachelors, let alone the other higher, and what that supervision then looks like as well.
That's a good point, Sarah. Thank you.
Well, I had a comment about the associate level licensure. So with the shortage of bachelor, master, clinical level licensed folks, would adding the associates further reduce or deplete the number of people that are pursuing those higher licenses that we already have such a shortcoming of?
And Eric, that's one of the things that I think it will do better is I think it will be a stepping stone for them to let them start there. Like a lot of our bachelors do, they start at the bachelor level and they move on up to the master's and then to the clinical level. And that's my hope for it. It's a stepping stone.
Well, my experience, like with the students, I teach a class at Pitt State, and none of them, of like 20 students, virtually none of them are planning to stop at the bachelor level because they've just been told that there's no financial reason to stay at the bachelor level. If we offer the associates, it might be a stepping stone, but most students, or at least what I've been taught, the ones I've spoke with, they don't have any intention of stopping at the bachelor level. So the associates level would just be adding in one more document that they could say they had. And I just don't know that that's entirely beneficial. And I'm not sure that it necessarily solves the issue of a shortage of social workers.
Are associate's degrees usually a 2-year degree, or I don't really even know what that is. So I could see the value in that in kids who maybe are not going to go to a 4-year university, or I'm speaking personal experience now. Like my daughter's high school starts transitioning people into careers their junior year in high school where they're doing college and high school. So I could see a market for it to be beneficial for kids like that who aren't going to go on to 4-year universities or maybe haven't decided exactly what they want to do.
Well, that was going to be one of my additional comments is theoretically you can graduate high school with an associate's degree now. And at what age do we want people licensed to practice social work with an experience level that we all can feel comfortable that they're going to represent the profession in a way that, they aren't going to get themselves into trouble or things like that. So, I mean, there's that piece as well.
That we already have them because I'm here within 200 employees and we already have them in our workforce. There are case managers, there are DCF workers, they're all over the state of Kansas and every other state. I site review across the United States. They're all over the place. There are graduates. So we're just getting old.
I think we need to pursue this. But
Yeah,
we have so many unanswered questions.
Mm-hmm, mm-hmm.
We need some answers before we can really look at this good.
Yes, I would really love to be able to talk to the 9 people that we have.
Mm-hmm.
I'm really curious, where are you at? What type of work are you doing? Is that inappropriate? I'm just wondering how we could learn from them, have some questions answered that we don't know. Because obviously I'm guessing they're working, if they're pursuing their license every year,
And renewing.
And renewing. So, there's something going on there, but that's my last comment. I know we have a lot of other things to discuss. But we definitely need new information, and hopefully David will be able to bring back some from ASWB, and we can continue to have these conversations. But Andrea,
David. Angie, I think you were going to say something. I don't know if I heard your audio.
Yeah, I was going to say that I know that we have the ethics, and then it kind of talks a little bit about the commitments to employers and some different information on that that we can refer back to as well. So I just wanted to point that out.
I don't know if that was just me, Angie. It was really hard to hear. I apologize.
I was just going to say that, the code of ethics that we have, can you read that? I can't remember.
Yeah, I
No,
think you're making the code of ethics.
There's information in there that specifies some things that we might want to look at.
Okay.
When we couldn't understand Katie, she turned off her video and that really helped.
So Angie, looking at the code of ethics, and there's some information there that we may want to review. Okay. All right, well, these are helpful questions for us to bring up as we look at this area. And I think I heard many people in agreement on this call this afternoon saying that workforce shortages are definitely an issue. I know we're feeling it and where I'm at, and sounds like many of us are in the same boat. So hopefully that we can all collectively work together and think of some creative ideas and go from there. So we will put that on the agenda for next time. And then it sounds like we'll be focusing on the workforce issue, at least for the next agenda time, and then we can reevaluate where we are during the next meeting. Does that sound okay?
That sounds good, keeping it under old business for a while until we come to some decisions.
Perfect. Thank you. All right. Thank you, everybody, for a good discussion on that topic. And then moving into new business. The first item under new business is advisory committee member expectations for year 2023. So I will hand it over to David.
Okay, well, thank you, everybody. I reached out to everybody over the last week or maybe two. So the advisory committees in the past, we are currently in the process of adding some structure to the advisory committee process. So the previous board governance policy talked about terms are 2 years and members can be reappointed for up to 4 terms. But until recently, a lot of those terms had kind of blended together. So we're in the process of looking to see, what's currently in the expectations for board members document, what's currently in the advisory committee policy, and trying to create some structure and help define some of those things that have been in there before, but we're trying to add a little more framework to. So I had reached out to all of the advisory committee members that were up for reappointment earlier this year to see if you were interested in being reappointed, and that information has been brought to the chairs of the advisory committee, and we're moving forward on that process. Additionally, in the expectations for board members document, it mentions that board members should have no more than 1 unexcused absence per year. And in the advisory committee policy, it states that the same policies that apply to board members should apply to advisory committees members as well, which means that advisory committee members should have no more than 1 unexcused absence per year. And in the past, it's really not something that we had tracked very closely. And we do appreciate greatly the time that all the advisory committee members volunteer to attend these meetings and help out with the discussion and even do work outside of these meetings. But we just wanted to give all the advisory committee members sort of a heads up that we'll be trying to track some of the attendance at meetings going forward for the next fiscal year for all the advisory committees, but just letting people know the expectations of as far as attending meetings. And to that point, we heard from members, we reached out to see, is there any issue with attending meetings at a certain time, just to make sure that individuals don't foresee having too many conflicts. And it sounded like this time, which is the 3rd Tuesday of the month from 1 to 3 o'clock, generally would work for most advisory committee members, but that it would be helpful to all of you. What we heard is that if you had some more notice of when those specific dates would be, so you could put them on your calendar to avoid potential conflicts with that too. So that's why we have In item 8, we have the dates for the next meetings. We went ahead and I looked at the calendar after I heard back from you all to look at when those dates would be if we followed the same third Tuesday of the month. So you have some advance notice of those dates here below as well. But the general idea is that, when we have things in the policy, we want to make sure that you're aware of those things. And then we want to make you aware that we're going to be keeping track of some of those things as a bigger picture, just trying to make sure that we're adding more structure and we're supporting all of you. But wanted to communicate that to you too, so you wouldn't be surprised or caught off guard. So that's the general idea.
Just making my notes here. All right, any questions for David and regarding the policies that were sent out? Questions, concerns?
Yeah, and as far as those policies, I did go ahead in your packet of material and include the advisory committee policy, which we walked through in the past when we talked about adding members to the advisory committee. So you do have a copy of that to look at again for reference. And then, as I mentioned before, the advisory committee policy says the same policies and procedures that apply to board members should apply to advisory committee members too, which is why you received a copy of the expectations for board members document. And that document does refer to things other than just the unexcused absence policy. It refers to a lot of other things that you should be mindful of, such as avoiding conflicts of interest and, being virtuous and, being responsible in certain ways. So make sure you just are familiar with those. And we talked about those a little bit during your training, but always a good idea to keep those in mind when you're thinking about your responsibilities as an advisory committee member.
Absolutely. And thank you, David, for bringing that up. And many of these items that we're discussing today is in hopes that we will all continue to be able to be on the same page. It makes it kind of tricky when we have a meeting that has lower attendance, as then we're not able to get the rich input that is so needed to move forward on these items that we're choosing to work on, which, certainly, as we all know, life happens and meetings are going to come up that we can't move, or, vacation, certainly things, we understand that things are going to come up. But just wanting to point out that it would be that one meeting, and that we do ask for advance notice, and that can go to David to let him know in advance that you're not able to make it. So Carolyn, anything that you'd like to add for that?
Well, just humorous. And speaking of attendance, for me, I won't be attending any more advisory meetings at the end of June, because I will have served my 8-year term. And so I wanted to give everybody heads up on that as well, because I have one more advisory meeting, and that will be in June. So.
Yes, thank you, Carolyn, for mentioning that very bittersweet news. So Carolyn has been the co-chair of this committee. Last time was taking the lead on this, and then she moved to the CRC committee, and has been just graciously showing me the ropes on how to co-chair this committee. So I still have a lot to learn, Carolyn, so it's hard to believe that.
And after 8 years, I'm still learning, so don't feel bad at all.
But we definitely have appreciated your time, and we can get in just in a deeper discussion during the next meeting. But wanted to make sure that everybody on this call was aware that next time that we meet on June 21st would be Carolyn's last meeting, unfortunately, as she has contributed such amazing ideas and just made this committee help to make it what it is today. So thank you, Carolyn, for all of your time and dedication.
Thank you. It's a
and
privilege.
Angie's giving you a round of applause. Yes, you definitely should.
Certainly a privilege, any role on the board and this committee to serve the state. I mean, each and every one of you represents a certain part of the state or the diversity that we try to select, when we pull together committees. So everybody is greatly valued. And so thank you very much.
Thank you, Carolyn, and we will look forward to dedicating some time on the agenda on the June 21st meeting to saying our official goodbye.
I'll bring my
But did not-
Kleenex.
Yes. But yes, Carolyn, we wanted to make sure to share that with you today so that nobody was taken by surprise the next time. So
Thank you.
thank you, Carolyn.
Mhm.
All right. Any other conversation around advisory committee member expectations for 2023? All right, thank you. We'll move on to our next new business item, which is discussion of the unprofessional conduct regulations. So in our last meeting, we had decided that we would take the time between meetings to read the unprofessional conduct regulations and then be prepared to offer feedback today. So David, did you want to add anything before we opened it up to that discussion?
Sure, just briefly. So this is something that I had asked each of the advisory committees, all 7 of them that assist the work of the board, to review their unprofessional conduct regulations and then come into these. Most of the committees are meeting in April, but to come into these meetings ready to discuss possible changes or updates to the unprofessional conduct regulations. And my hope in this process is there's a couple of goals that I have. One is to make sure that we are being diligent and looking over our regulations to make sure that they are still current, that the language in them is not outdated, that if there are changes in technology, we're thinking about that in terms of applying these standards towards practitioners and ultimately making sure that we're doing what is necessary to make sure that the public, the people that are receiving the services, are still protected through the work of these unprofessional conduct regulations to make sure that the individuals providing services are doing so in a responsible way. I understand that there's quite a few items in the unprofessional conduct regulations and that there are other resources that potentially could be used as part of this process. So I don't expect this to be a one meeting type process. My goal that I've shared with the other advisory committees is that I hope that this can be part of a conversation this year and that we take some time in these meetings to sort of put together a list. And at the end of the year, maybe have a list of recommendations that can be recommended to the board and then move forward with that. So I don't expect this all to be completed today, but I think if we get some good discussion on some possible changes and then we build on it over the course of the year, by the end of the year, we'll have some really good ideas to move forward. And with that, I'll go ahead and I'll share my screen. I've got the unprofessional conduct regulations pulled up. Maybe be helpful to kind of have them in front of us as we look at them. And then if individuals did have some initial comments on those regulations, we could go ahead and talk about those specific regulations. We don't have to go regulation by regulation, but if you did have some, we could go to that item and then have a discussion on those points. And I'm assuming you all can see the KAR 102-2-7. Great, okay.
So as I was reading through these, one of the things that I noticed is there wasn't anything regarding technology use.
Yes.
The telehealth is a big thing now, and I think that there needs to be some language added around unprofessional conduct when it comes to televideo, et cetera.
And texting, I'll add that, Sarah. On the CRC committee, I'm finding there's a lot of unprofessional conduct regarding all of these things. Because it's relatively new. Technology is really moving so fast that I think we do need to add something.
And Sarah, did you have any specific suggestions along those lines, or was that just an area that you identified that there's?
No, I mean, not really specific suggestions, just an area, because yes, I agree. Texting is another thing. I also think that there is, there's some concerns about what is HIPAA compliant as far as televideo usage, specific programs, et cetera. And so I think some language around it, you know, making sure that if you are using televideo, that it is HIPAA compliant, those kinds of things. So I didn't have any specific suggestions as to wording, but I think it is an area that may have exploration opportunity.
Right. Because there are some televideos that are not accepted, for instance, Zoom, and that are more acceptable with this type of service delivery. I also wanted to add emails, emails and texting, because whenever you do that, the misuse is, including therapeutic content and those forms. That's not confidential at all.
Yeah, that's such a good point.
Well,
So
some of it depends on where you're at, though, because some of it is confidential.
Yeah.
So it's not a general statement. And Zoom isn't you can have your licensed professional Zoom, which is a paid license. So that's different than your general Zoom. So it's not all blanket.
That's good to know.
So that's the other thing. Your EHRs are now going to the point that they're embedding their tele inside, but we still have that professional. Your other means, media means are going to the professional levels because we vetted all of that because of that issue right there. And Zoom also was under scrutiny, and so they've had to go through all that vetted process too. So you said something a while ago that I started to address, the texting, like with the state, federal, and state grants and everything. We have clauses in there that has to do with texting and driving and things like that. That may be something that we want to look at in the wording and address it because they have the language already, and it's really it's well written. But when you sign those grant assurances, you are signing about texting, and so it may be something that we look at.
We might be able to find, so not to reinvent anything, but the ASWB and the KNSW, I think, put together some standards that we could look through and see if we could.
Yeah, that's what. Carol, I'm going to piggyback on that. Can you hear me now? I hope.
I can.
Okay. There's the highlighted reversion of the Code of Ethics that just came out in February of 2021 that has telehealth information.
Okay, great.
And references a lot of that, and they even highlight it so you can see where they added those kind of elements to those certain areas. And I thought that was really like making audio and video recordings and, just on and on about some different things. And I was trying to put it in the chat, but there's no chat to give you the address for the one I'm referring to, the highlight revisions to the Code of Ethics, because I think that's where you will find it highlighted, those new things that are happening that they're updating and keeping us informed. So.
Yeah, if you want to send that to me, I'm happy to send it out after the meeting to the advisory committee members. So.
Okay.
Thanks, Angie. That's great.
This is such a lengthy list already.
When I was reading these, I'm thinking, who wrote these things? And actually, I'm glad that we are revising them. It's like 2008, I think, is the last revision. But I have one silly little question. I don't want to spend any more than 15 seconds. David, this order of organization, starting with A to Z, then A to Z, then A to Z, this is very, very difficult to read and sift through, and it's hard to find the main points. I often wonder, why didn't they start with one and then put small a, small b under each one? And that way you would never end and have to do AAA. So I just think they're kind of hard to read. And, but having said that, is that how everything is written?
Unfortunately, Carolyn, yeah, we're sort of bound to a certain legislative style.
And consistency.
Yeah, there is an overall editor who controls sort of the way that the regulations read, following this style with the little a followed by one, followed by big A, but it does make it difficult to read. And I think right now the priority in their office is to make sure that the style stays consistent with past style, but it does make it difficult, especially when you are not familiar with looking through some of these, or even if you are tracking these. And I think some of the other advisory committees have discussed that too, and going through this, that, you know, it's difficult to actually read through these to follow them in the way that they were intended. And so I know one of the other advisory committees has had a preliminary discussion to see, is there anything maybe that the BSRB could do to try to maybe take the text of these regulations and make them more readable for licensees or members of the public? And so that is something that we've had very, very preliminary conversations with our legal counsel for the board to see how we can move forward with something like that. But that is something on our radar, and we definitely see a value in that. But you're not alone in having those thoughts. Yeah.
Okay, thank you, David. I kind of figured that would be the answer, but I just, but I really like the idea of trying to come up with something a little bit more user friendly and, you know, and easier to understand, since they're so important, you know.
Mhm.
You're changing history, Carolyn.
I know, gosh darn it. Maybe the one thing I can change before I leave now. Yeah. Thank you, David.
Sure, you're welcome. Are there any other maybe specific items that anyone had a comment on in the list? If not, I can go ahead and stop sharing my screen, but I thought if anyone had an individual item they wanted me to highlight, I can go ahead and move to that item.
You can go to L. Oh, sorry. That one, discriminating.
Oh.
That one needs updated for
Yeah.
sure.
Yeah, doesn't have all of the
Yeah.
information.
But it's referred on 4.02 in that document I was telling you about that updates the current wording to encompass everyone. So
Very good.
You said which document for?
it's that one I just referenced about the highlights.
Oh, okay, got it, got it.
But it's
Yeah,
number
it doesn't follow.
4.02.
It doesn't follow our civil rights documentation and our language, our new language.
I appreciate that comment on L. Anybody else have any specific items they would like me to visit on here?
Is there anything, I'm sorry, as I read through this, is there anything about practitioner self-care? Because I know that KNSW, one of the code of ethics, I think they're, you know, including this. And often in, you know, CRC complaints, sometimes it's practitioners that are not, I know that's really hard to define, but it's often, you know, and I guess and maybe that would be part of the problem, is really how would you word that? Or is there something in here that I missed about the importance of?
There's something about
Thought I'd seen something.
not taking care of yourself, not recognizing that you need help and seeking help.
Where's that at?
It was the mental health clause.
Okay, gotcha. Okay, good.
I read it.
Where? H.
Yeah, that's it. That's it. Yeah.
Do no harm. The language on that one, it doesn't say it exactly like what I just said, but
And I made a note about the practitioner self-care item, if we can revisit that in the future at meetings and maybe compare some language from one of the associations to see if there's better language for that topic.
Okay. Thank you. I believe they added. I believe they've added that in the code of ethics. So they've highlighted that. I'd have to look that up to see the new.
Well, and I have some concerns on some of this because some of it is subjective. And that's what I get a little nervous about, is the governance of the subjectiveness of it. So
Yeah, and I know on some of these, it's the details are really going to be helpful when the complaint review committee might, look at any of these to factor in different things that could be different in one case versus another, because there is likely some subjectivity that would come into play on some of these. Well, I appreciate all of your comments on this so far. I'll go ahead and stop sharing my screen and we can continue this conversation at least a little bit at the next meeting. And I will go ahead and look for some additional resources. I'll share the link that was sent out so you can go ahead and start to compare that. And as time allows, I'll try to look to see if there's other resources such as maybe some information from other surrounding states that we could bring into this equation too, and not to look at and necessarily to adopt those, but they would helpfully provide some context of what other states are looking at or what they have included as well. So
that sounds great. Thank you. Thank you everybody for their feedback on those items. All right, moving next to the next item under new business is proactive approaches to public protection. David, do you want to start us off?
Sure. So one topic that I have had a conversation with several board members about is that, we are a public protection agency with the Bsrb, but unfortunately, a lot of the work that we do is fairly reactionary. And, someone commits a violation and then we do our due diligence to hold them accountable for the violation. But the assistant director, Leslie Allen, and I, we really make an effort to go out and speak to students at schools to talk to them about details for the licensing process, but also to give them some advance notice about some of the disciplinary issues and some of the unprofessional conduct items. And the hope is that, helping people understand those items in better detail means that they're less likely to run into a problem later on. And as we talked about when we looked at the unprofessional conduct regulations, some of that wording and the structure is hard to follow. And so what I have seen a lot is practitioners trying to find out, I want to make sure that I'm doing this the right way. And while we as an agency can't provide legal advice, perhaps there's more things that we could do as an agency to get out there to help licensees. And we've also had members of the public that have come to us that have questions and say, well, a practitioner did this, is this a violation? And, the facts are going to make a big difference in a lot of those situations. So we tell someone, if you would like to file a complaint, you're welcome to do so. But sometimes I think there is a genuine question for members of the public where they're not sure if what they experienced is something that's just unusual to them or if it's a violation of the standards. And we do provide a little bit of information in terms of, if something is a criminal matter, perhaps they should pursue talking to law enforcement, or if something is more of a civil matter, we want to make sure that they know that there are other remedies out there. But if, as an administrative body, we are limited into what we can look at in terms of the licensees and their responsibilities, but we do want to take those responsibilities very seriously. But there are times when members of the public just have a difficult time knowing what to look for and whether something has been a violation or should they submit a complaint at all. So I think the reason why we put this item on the agenda, at least in part, is to allow the advisory committee to have a discussion about maybe there could be ways that the BSRB could be a little more proactive in terms of helping the public or helping licensees with our public protection mission. So we just kind of wanted to open up and start the discussion process for all of you, and kind of to share our thoughts as an agency, but also to hear your thoughts and see if you had any ideas about ways in which we could be a little bit more proactive at protecting the public. And this goes beyond just the statutes and regulations. We have added items to our website to try to help individuals understand our processes more. Part of that had to do with changes to the board governance policy to split that up. We added a new policy back in January that had to do with expectations for public members when they attend our meetings, to kind of get a better understanding of who we are and what the advisory committees do, and what they should expect if they want to sit in on a meeting or provide public comment at meetings. And so we are taking some steps to try to help individuals understand our mission more. But we understand that you guys also have perspectives that we may not have here in the office. And we'd like to allow you guys to start thinking about this process, either comments today or comments to bring back at a future meeting.
I know one that has come up for me recently is trying to increase awareness of when we are able to call ourselves a social worker and when we are not. So I think that there's still some confusion on when that you cannot unless you are licensed. And so just making sure that we're building some awareness around that for everyone.
Maybe as a homework assignment for the next meeting, maybe take another look around the BSRB website. Just take a few minutes sometime between now and our next meeting and look around. Look at our frequently asked questions that we've posted up there. See if there's any items that maybe you have thought about or items that you have heard, and see if we are addressing those on the website, and then maybe bring those back for the next meeting.
David, one of the things that I wondered about, have you ever thought about doing any vignettes or role play on a website, on your website, our website, that would show different scenarios that people might pose and wonder about?
Yeah, that's a good question. I don't know that we've actually thought about that, or that we've had discussion on it. We've talked about using, back in January of 2021, we started the BSRB YouTube channel, and we've used that as a way to broadcast our board meetings and advisory committee meetings. And we've had some basic conversations of, is there a way that we can use that channel to maybe put out some other helpful information? So maybe that would be something that would be a good place for something like that to go. So I'll make a note of that so we can think about that a little bit more.
Even like what Andrea said, a simple definition of what a social worker is, kind of acted that out from, the non-social worker, or someone calling someone a social worker that isn't, and helping them understand that. I mean, it could be fun, but also very informative.
That's a good idea, Jane, to use videos to portray that. And of course, we would want to use real live social workers. So, I mean, look at this group right here. We could draw from these lovely individuals.
Do Hollywood squares right here.
Does anybody have a degree in theater?
I'm
think it's a
wondering
great
if
idea.
some proactive measures could be tacked on to, things like social worker safety, because essentially it's not just physical safety, but these are unprofessional conduct, tagging onto that, like that can all be, safety. So I'm wondering if there's a way to maybe tack it into some of those programs where before you renew your license the first time, having a social worker safety course that incorporates some of those ways to do like the videos or the role play, or just to be more aware of what that looks like, just because that is so, I think a lot of times maybe people struggle with some of those things unintentionally, and not from, intentionally trying to tarnish the profession or not follow the code of ethics, but then kind of find themselves in some of those sticky situations. So maybe tacking it on to something we're already doing, but taking it a little bit further might be beneficial as well.
Those are good ideas.
Absolutely.
How to do a supervision plan. I mean, I can see Leslie and Joanne doing a YouTube. I mean, we could come up with a lot of ideas, you guys. Leslie, we can keep you busy.
So we're all voting Leslie as the primary actress. Yeah, those are great ideas.
Those are great ideas. So keep in mind, just until the next time we meet in June, keep that at the top of your mind of, as you're having other conversations with colleagues, what might be some things that we can be proactive about. So thank you, David, for looking at that. That's a great idea for you and your team. So appreciate everybody's input as well. All right, we'll move on to the next item on our agenda. I know we're getting close to 3 o'clock hour. It's committee discussion on items for next meeting. Is there any new items or just other ideas that you guys would like to have on the agenda for next time?
Well, I'd like to recommend that we go ahead and separate those 3 items in old business. So I don't know that today we had any a good discussion on the supervision or the CEUE, and so it'd be kind of, CEU, it'd be nice to, revisit those 2 areas as well as continuing our conversations on the workforce.
Thank you, Carol.
I like the suggestion.
Any other suggestions or things that have been on your mind that we need to address as an advisory committee? All right, I always want to make sure that we have input from you all. Kristen, were you going to say something? Oh, okay, sorry, I thought I saw you. Didn't want to move on. All right. So then,
one quick thing too is I'm going to go ahead and send David the link, and maybe he could send that to you all on the highlighted revisions on the Code of Ethics, which does have more language regarding professional and personal self-care.
Thank you. I'll send that out after the meeting to everyone.
Okay, yes.
oh, you're on mute, sorry.
If it's helpful for everybody to have that link, David, you could share that with everybody.
Okay, I'll do that.
That sounds great. Thank you. All right. And then, as David had mentioned previously, they made sure to put the next meetings coming up on our agenda. So please block your calendars for that. And typically that would be from 1 to 3. There are some times where we go over a little bit, but try really hard to stay within that time frame because we know everybody is very, very busy. And then we are at the end of our the end of our agenda. So I would love to hear a motion to adjourn.
I so move.
Yeah,
Who was that first? Sorry.
I think Lee on the phone moved to adjourn. So
I second
And
that.
thank you for that second. All right. All those opposed? All those in favor? Say aye.
Aye.
All right. And the motion passes. We are adjourned. Thank you, everyone, again. Enjoy the rest of your week. Take care, stay safe, stay warm.
Thank you.
Thank you.
Bye-bye.
thank you, everyone.
Bye.